large majority of adolescents and teenagers who experience chronic pelvic pain conditions and do not respond to traditional therapies, medications, most commonly used birth control, they end up being diagnosed with endometriosis eventually. And on average, it can take 7 to 12 years to reach diagnosis from onset of symptoms and a visit to 9 different doctors. I'm trying to help you avoid those timelines with this information, and I hope it's helping. Okay, let's talk a little bit about birth control. So birth control is a very common treatment used for endometriosis. I would argue that it doesn't really treat much. All it does is suppress symptoms, turn them down, kind of like a Band-Aid. But here's what you need to know about teenagers and birth control post-operatively. So it'll be very common for somebody to experience deep excision surgery, and their post-operative treatment plan involves either hormonal, contraceptive, or GnRH medications, which, by the way, GnRH have not really been proven to work any better than hormonal birth control, and they're a lot more expensive, and the side effects are horrible. I'm going to read this verbatim. There remains limited data on the efficacy of post-operative hormonal management of endometriosis in the adolescent population. Do with that information and help your child make the best decisions for their body, for themselves, as you please. I would argue, being a person whose symptoms started at 5 years old and who has lived with chronic pain since that age and ended up with stage 3 endometriosis and irreversible damage and organs removed from my body, I will just share this information with you to help you make choices on how to support your child. Endometriosis surgery is never the one-size-fits-all solution to endometriosis. What I mean by that is most of us end up having surgery, medication, acupuncture, pelvic floor physical therapy, talk therapy, trauma therapy, whatever, because that can be associated with chronic illnesses. And all of that is like your Western medicine, traditional medicine therapies that are offered. But I would argue that there are things you can start doing for your kid right now to help them, and that might help them more than some of that other stuff. But I'm not a doctor, I'm just a person who's lived with it, so disclaimer, okay? These are the things that you can start doing right now. Number 1, reduce inflammation. Reduce inflammation through diet and lifestyle changes. Lifestyle changes include reducing stress, reducing exposure to toxic chemicals, endocrine disruptors, getting good sleep, balancing blood sugar, digestion, maybe starting to go to a pelvic floor physical therapist, and even an acupuncturist or a masseuse, honestly, depending on the most important thing you can do as a parent with a child experiencing chronic pelvic pain is to believe them and